Hello and welcome everyone. You are watching Opinion Class and this is Tanishka Punti. In this video, I'll tell you about a mysterious lung inflating disease which is spreading in China and that is also infectious like corona. So here I go. The coronavirus, which originated in Wuhan city of China, had spread to every country on earth by 2020. The virus itself has imprisoned millions of individuals in their houses all around the planet. Every nation, including China, Nepal, India and the United States, was forced to implement a lockdown. Recently, this nation has been the source of news about another frightening illness about which the WHO, that is World Health Organization, has also issued a warning. In fact, youngsters in China's northeastern province of Liaoning are reportedly becoming sicker at a rapid rate, according to a Chinese media. Children who have this illness typically have symptoms like a burning feeling in their lungs, a high fever, a cough and a cold. It is currently known as mystery pneumonia. Schools have been closed in order to stop the illness from spreading and to keep kids healthy. But this is not the first virus-borne illness that has alarmed other nations, notably India. Following the corona pandemic, numerous infections including Ebola, Zika and monkeypox have made headlines in recent years. The unique aspect of these viruses is that they all are products of Asia and Africa. In light of this, I'll explain you in this video how to prevent this unexplained pneumonia and the reasons behind the recent rise in virus-borne illness in Asia and Africa. Let me tell you about China's enigmatic pneumonia first. In China, a mysterious pneumonia virus is increasingly targeting youngsters as its victims. Children who contracted this virus often have symptoms such as fever and lung pain. The patient also has trouble breathing as a result of lung pain. The pediatric hospital in Liaoning, Beijing, is currently full of children suffering of this virus, according to Chinese media reports. Now the question is, why is this illness seen as distinct from pneumonia? Speaking about the symptoms of pneumonia, the patient actually experiences chills, fever, coughing, and difficulty breathing. However, with regard to the virus that has been spreading throughout China and is being dubbed mysterious pneumonia, the children who have contracted it do not exhibit cough symptoms. Instead, they experience a high fever and pulmonary swelling. Now, I'll tell you what was stated by World Health Organization. As of right now, China has been requested by the health agency to closely monitor the cases and symptoms of this disease. In addition, WHO has also released some guidelines about the virus which people have been cautioned to avoid. According to guidelines, it has also been said to contact the doctor immediately if any symptoms appears in the body. Apart from this, it has also been asked to maintain social distancing and use of masks. So, is this virus also an epidemic like corona? In fact, this mysterious pneumonia has not been yet declared an epidemic by the World Health Organization. At the same time, surveillance platform PROMED also said that it would be wrong and premature to call it an epidemic at this time. The World Health Organization has also asked for a list of all types of viruses currently spreading in China to investigate this disease. After the first case of H9N2, which is also known as avian influenza virus, was reported in China's last month, a meeting was organized under the chairmanship of DGHS regarding its preparation, the report of which was given to WHO. Now I'll tell you about India alert about this mysterious pneumonia. Recently, the Union Health Ministry of India, while mentioning the disease in a statement, said that the risk of the spread of this virus in India is very low. But even after this, the ministry is keeping a close eye on the situation. According to a statement from the ministry, India is at low risk from the avian influenza case as well as clusters of respiratory disease reported from China. It has also been said in this report that India is prepared for any emergency arising from this dangerous virus spreading in China. Where are the most dangerous virus-borne disease found? According to the World Health Organization's disease outbreak news, from January 2021 to 2022, patients with virus-borne disease have appeared in Asian or African countries. Disease Outbreak News is an organization of WHO that works to report cases of known and unknown disease globally. According to the same report, a 63% increase in zoonotic disease from Africa has been seen between 2012 and 2022 compared to 2001 to 2011. Apart from this, according to the report of the American naturalist published in 2016, West Africa is the highest risk area in terms of viruses spread by bats. According to the data from the year 1900 and the year 2013, the sub-Saharan African region and the Southeast Asia are also risky areas in terms of such diseases. Now the question is, why are most viruses found in this area? One of the biggest reasons for this is the population density in these continents. Due to the high population, the chances of people coming in contact with animals increases. In such a situation, the risk of spread of diseases increases much more. Currently, about 60% of world's people live in Asia and Pacific regions. Due to the increase in population, humans and animals have started coming into direct contact. There are many dangerous viruses in these wild animals which have not been discovered yet. Take bats for example. More than 100 varieties of this small animal can be found at any time. These viruses reach humans by passing from one to another. Going through changes in these areas is also a big reason. According to researchers, Britain also went through similar changes during industrialization in the 18th and 19th centuries. At that time, Britain had to face many diseases like typhoid and cholera. Talking about Africa, the incidents of humans getting infected due to the infection spread by animals are centuries old. But in old times, due to lack of means of transportation, this virus remained inside Africa only. Apart from this, poor health services and social unrest are also major reasons which can also be blamed for the spread of these diseases.